Thank you so much, Dr. Stevens. I'm so excited to be here and share this information with you all tonight. All right, so I'm going to review the learning objectives for this talk. First, to be able to demonstrate how chronic pain and sexual concerns intersect through the biopsychosocial model. Second, to review empirical data on how chronic pain affects sexual functioning. Third, to debunk myths about sex that can really impede intimacy in couples coping with chronic pain. And lastly, to identify resources and interventions for individuals with co-occurring chronic pain and sexual health concerns. And just more broadly and more informally, I really hope that any attendees this evening that are experiencing sexual concerns themselves or in their relationship related to chronic pain come away feeling like they're not alone. So that's something that's really important to me about this talk. So before we really dive into the connection between sexual health and chronic pain, it's important to get a sense of what we mean when we talk about sexual health. So the World Health Organization has a really nice holistic definition of sexual health. And some key points are that sexual health does not just mean the absence of a disease or dysfunction. It really brings up someone's mental, physical, and emotional well-being when it comes to sexuality. So it doesn't just mean someone's not experiencing distress or not experiencing dysfunction or disease, but they have well-being related to sexuality. And with this comes the ability to have safe and pleasurable sexual experiences, and also access to accurate information. This is a really nice person-centered and holistic approach, and it's also important to remember that cultural norms and values will also play a significant role in how different individuals and groups view sexual health. So now we'll review a definition of sexual dysfunction. So this would mean difficulties with sexual functioning that would meet diagnostic criteria because of their duration or how long they're lasting, their severity, or the level of distress that it's causing the individual. This is often due to a combination of both physical and emotional factors. In some cases, there might be a direct physical cause for the sexual dysfunction, such as a medication causing low libido. A lot of medications that are prescribed in the context of pain, such as antidepressants, can cause low libido. Another example might be menopause causing vaginal dryness, and that can lead to pain and sexual dysfunction. But most often, there's a combination of physical and emotional and relationship factors playing a role, and it's not always a very simple medical reason. And it's important to emphasize that someone can have sexual health challenges without having a full medical diagnosis of sexual dysfunction. So I think that's just something that's important to note here. And for those with chronic pain that may not have pain conditions that seem to obviously impact sexual functioning, such as like a pelvic pain condition, there are other pain conditions, and we'll get into this a little bit more, that can really lead to sexual health challenges. So something like back, neck pain, migraines, it may not seem obvious that that would cause difficulties with sexual functioning, but they often do. Sexual dysfunction is often conceptualized in three categories. The first would be difficulties with arousal and libido. The second would be pain with sex. And the third would be difficulties with orgasm, such as timing or ability. And individuals with chronic pain can experience any and all of these types of sexual dysfunction. So with those in mind, I want to introduce some common myths about sex that can be particularly damaging for individuals with chronic pain and couples that are coping with someone with chronic pain or chronic illness. So the first one is that sex is just for young and able-bodied people. The second is that sex should always be spontaneous and there doesn't need to be any planning or preparation to have an enjoyable experience. Third is that someone's partner should just know what they like and what they don't like, and it's just better to not have to talk about it. And another one would be that there's something wrong in the relationship if there isn't a certain amount of frequency around sexual interactions. So we'll come back to these, but these are some myths that I want to emphasize can end up really causing a lot of distress in the context of coping with pain and sexual dysfunction. Often these myths are perpetuated because we really don't have enough communication about sex. And I say this because it happens not just with couples, but also in relationships between providers and patients. And so what we see is that a lot of providers have cited things like their own embarrassment, lack of training in their medical school or fellowship, lack of time during their interaction with patients, and also sometimes an age and ability bias with who they might choose to assess sexual functioning for in their interactions. And so often patients that might be of older adult age or those kind of coping with a chronic illness or injury, those might be reasons that a provider might think, I don't think this is probably very important to this person. I'm not going to take the time to look at it. And again, this isn't something that someone's doing on purposely to be negligent, but it's just some of these unconscious biases that we may have when it comes to interacting with patients. And what happens is the patients also report that they feel embarrassed about bringing it up with their doctor, but they kind of hope that the doctor is the one that will bring it up. And what happens is this leads to an avoidance of communication on both sides. And what's difficult is if a patient's having some struggle in their relationship and there could be something related to their medical condition, if it's not brought up by their doctor, they might feel maybe a sense of shame or like this isn't really something worth bringing up or it's my fault. That's why things are going wrong in my relationship. So it ends up being this really difficult cycle to breaking down the stigma of having open conversations about sex and sexual functioning, especially in the chronic pain world. So here are a few things that we know about the connection between chronic pain and sexual problems. One is that we know in this pain clinic and in the pain literature that chronic pain affects the body, the mind, and the relationships. And these are contexts where we're also experiencing our sexual health. It's affecting the body, the mind, and the relationships. So they're just really difficult to disentangle. Individuals with chronic pain are more likely to be anxious about sexual activity and more likely to experience sexual difficulties than individuals who are not dealing with persistent pain. And what's really interesting is that this particular study and others as well have shown that improving sexual function can improve the quality of life for individuals with chronic pain, even when there's not a change in their level of pain. And I think this is an important point because some providers might say, gosh, there's so many things we need to target with someone dealing with chronic pain, like where does sexual health fall into place here? But sexual health and sexual enjoyment can be a really wonderful protective factor for someone's quality of life and can really strengthen the relationship. And so I think this is a really wonderful point to emphasize when it comes to why we might want to make sure that we're assessing sexual health and why patients can really feel empowered to bring this up and make it part of their treatment plan. And like I said, this is something that just may not come up in chronic pain care. So that was why I wanted to bring this presentation to you all tonight. And like I said, pain conditions that co-occur with sexual problems may not be ones that seem so obvious. So some that actually are quite commonly associated with sexual problems. Of course, pelvic pain is one that seems obvious, but also migraines, fibromyalgia, and then spine pain. So the literature shows that often these pain conditions really are likely to come with some sexual dysfunction. And so for the data geeks in the audience, I'll share just a bit of data about co-occurring sexual problems and chronic pain, but I'll say that this is a kind of an under-researched area. And so I'm hoping that it grows, but one study found that more than half of males and more than 70% of females with low back pain reported sexual problems. And in this study, this was about twice that of the healthy controls when separated by gender. Another study found, this was actually a systematic review that found that individuals with chronic musculoskeletal pain reported significantly reduced sexual functioning or satisfaction compared with healthy controls. So that was a recent systematic review. And maybe not quite surprising, a study of women with pelvic pain found that 70% endorsed sexual dysfunction compared to just over 30% of women without pelvic pain. And really just to kind of tie this all together, the prevalence of co-occurring chronic pain and sexual problems is high, but it really varies depending on the pain condition, the study sample, the study setting. So there isn't like one simple number to kind of capture prevalence and incidence, but in most studies, it's really showing, we're really seeing that more than half of individuals with some sort of chronic pain condition are experiencing sexual problems. All right, so now we're going to look at the biopsychosocial model of how chronic pain and sexual health intersect. So in this Venn diagram, you can see that the biopsychosocial model takes into account the whole person in the context of their physical functioning. So that would be the purple bio circle, their mental and emotional functioning, which would be this sea green psycho. I don't love the word psycho standing alone, but we know what that means there. And then their social functioning. So pain and sexual health really have to be conceptualized with this biopsychosocial model. And so someone with chronic pain may be having difficulties with their actual positions or endurance when it comes to sex. So it may just be that there's pain getting into a certain position, or they start to have pain because of the duration of sexual activity. So that's kind of an example of the biological side. Another one would be medication side effects, like I mentioned, causing fatigue, causing low libido. And another one would be poor sleep. So we see a lot in the pain clinic that individuals with chronic pain have a lot of sleep disruption. And I think most people could agree that when there's not great sleep, it's really hard to have the motivation and the sense of relaxation to have a high sex drive. So those are just some of many examples of kind of just the biological side. From a psychological standpoint, there may be depression or anxiety that was pre-existing before maybe the pain condition came about, and the pain might be exacerbating those things. Depression and anxiety can develop after an injury that's led to some chronic pain. So it's not always, it's difficult to sometimes figure out which came first. And also an injury associated with a trauma may make sexual encounters really difficult for someone. Or even just the ability to feel close with another individual. So past trauma can really exacerbate pain and make sexual encounters and intimacy really challenging. And then really, really important here would be the social aspect. So just the relationship dynamics. How is the partner responding to the pain condition or these changes in libido and sexual functioning? And then also incredibly important, how are they communicating with each other about this? And so actually the literature shows that sex is one of the most avoided topics in couples in general. And then when you bring in a chronic disease, it's often avoided even more. And so the more we avoid the issue, the more difficult it can become. And then often when there is communication, it's not the best communication. There can be shame and defensiveness and not coming from a place of openness and compassion. So we'll talk more about ways to navigate this. But this is just many examples of how chronic pain and sexual health really need to be conceptualized through the biopsychosocial model. All right, so we are going to illustrate these points further with an imaginary case example. So this isn't a real person, but it's something that we might see in the clinic that I think is pretty relatable for these issues. So we're going to imagine a woman named Rosa. She's 45 years old. And she works as an owner. She actually owns and operates her own fine dining restaurant. So she's on her feet a lot. And a few years ago, she strained her back carrying some heavy boxes of wine. So she's got this back injury. She's still working at this restaurant that she runs, but she's often in the office, sitting at the computer and really avoiding physical activity. Her life is pretty stressful because she's working these long hours. And her husband, Mark, is a school principal. So they have very different hours. And they also have two school-age children. So this is a nice recipe, no pun intended, for a lot of stress. So this just is an example to have in the back of your mind as we walk through a model of how pain and sexual dysfunction and how pain and sexual concerns can really come to play in a relationship. So we think of this model as the fear avoidance model. So what happens is Rosa and Mark have a sexual encounter, and right during the sexual encounter, Rosa has a really bad flare of her back pain. Immediately as she's feeling the pain, she starts to have a lot of negative thoughts and difficult emotions. So she might think, oh my gosh, I made my pain worse. How am I going to go to work tomorrow? Now Mark is going to be worried about me, and he already has all this stress with the parents and the kids at his school. And the kids need so much from me this week. How am I going to get through this? And she starts to feel anxious and worried, and really her stress goes up. At this point, Rosa and Mark start to have like a sense of disconnection from each other because they're not really talking about it. They both are worried about bringing it up, worried about saying the wrong thing. And so in the coming months, when they have some precious alone time, which you can imagine with their jobs and their kids is quite difficult, if they get close to any sort of intimacy, Rosa has this anticipatory anxiety about hurting her back again. So she's having the negative thoughts again, and she might even, because of these difficult emotions and anxious thoughts, she might even kind of have anticipatory pain from tensing up around these thoughts. So at this point, she is either probably most likely to avoid the intimacy with Mark because she's feeling tense, she's having these really distressing and distracting thoughts, or because generally they have a loving relationship, she might move forward and endure the encounter, but without enjoyment, from a sense of obligation or pushing herself. And at this point, she's left with little to no positive association with intimacy with Mark. And Mark, being the loving partner that he is, can probably sense that she's feeling this way. And he's not going to have a positive association with intimacy either. And so what happens is this interaction is devoid of pleasure, or there's no intimate interaction with all. And couples can tend to really drift apart and struggle with how to move forward. So this cycle is just kind of an example of what can happen when someone is experiencing pain and stress and sexual dysfunction. So I want to revisit these myths about sex that I introduced because I think they are really relevant to what's happening with this imaginary couple. So this idea of sex only for young, able-bodied people. Well, at this point where Mark and Rosa are, they might start to have some feelings of giving up, like, well, we're getting older. Not that 45 is old, but she's got this back injury. Maybe it's not even worth working on. Maybe that part of our life that ship has sailed. So they might have kind of embraced this myth. Also, this idea that sex should be spontaneous and shouldn't be planned. If there isn't really any discussion around what might help Rosa relax, what might help them both kind of get into a more safe space for this, they're going to kind of be maybe holding on to this myth that sex should always be spontaneous. And if it doesn't happen that way, there's something wrong with them. The idea that the partner should just know what's going on without them talking about it. At this point, Rosa hasn't expressed that she's having these difficult thoughts and emotions and physical tension around intimacy with Mark. And so, because maybe they've never had a difficult interaction like this before, they don't really know how to talk about it. And this idea about frequency, some couples will really think that there's something wrong with them if they're focused on quantity over quality. And all of the top researchers and researchers in sexual health and romance and relationships would really want to debunk these myths. So we will get into that with some truths about sex. The first thing is that sex and intimacy can be pleasurable for those with chronic conditions and well into later adulthood for someone who wants that, if that's a value for you. It may not be for everybody, but it is very, very possible. Secondly, that it's completely okay to need some preparation before intimacy. So when we get into some recommendations and resources, I will really talk about how the best researchers in sexual health will completely normalize needing relaxation time or things that really help couples get in the mood, and that being attached to this idea of everything being spontaneous like it is in the movies can be very damaging for couples, especially when there is trauma, depression, anxiety, pain, things like that. Also, communication is key. The idea that you and your partner should just understand each other without having difficult conversations is just not what the literature shows us. And couples who can communicate about difficult topics do a lot better. And so getting through the difficult communication is where the magic happens. And lastly, it's not about quantity, but it's about quality. So for couples who can find ways to experience pleasure, as long as the interaction is pleasurable for both people, there's no magic number for what is healthy. It's individualized for every couple. And of course, there can be challenges when maybe each individual partner has different ideals, but when both partners can find pleasure in the encounter, that is the most important thing. So I want to emphasize that all is not lost for Rosa and Mark, and for other individuals listening or out there who might be experiencing chronic pain and sexual dysfunction. So I'm going to go through a lot of different possible interventions that are out there and evidence-based and resources for you that really touch on the biological, the psychological, and the social aspects of chronic pain and sexual dysfunction. So the first thing we'll look at are just some options for dealing with really just the physical side of these issues. So the first one is for individuals to make sure that they're just reviewing their medications with their providers and seeing if it might be a medication issue that's leading to any changes in libido or fatigue, and if there's any wiggle room there. And also if the pain control is being appropriately managed with medication. So that's just something that is, something to review with your provider if you have concerns about your sexual functioning. Second would be something that a lot of people don't think about or realize is considering assistive technology to help with sexual functioning. And in my next slide, I'm going to show you some wonderful resources where you can read more. But I really want to highlight this, that we have really grown in terms of what's out there for this topic. There's a lot more out there than people would think, and it can be incredibly helpful and make things much more pleasurable and attainable when there's a disability or a pain condition. And lastly would be the importance of engaging in physical therapy if your treatment team thinks that that's appropriate and would help. So there's kind of two sides to this. Of course, with a pelvic pain issue, there's pelvic floor specific therapy that can really be targeted to make sexual interactions more comfortable. And that's very specific for pelvic pain. But if there's an issue with certain positions or with endurance, physical therapists can really help with things that will improve your mobility and your endurance and your strength overall. And often that can carry into sexual functioning. So those are things to share with your team and kind of not neglect the fact that physical therapy can really help when it comes to our sexual functioning. I'm going to show you some specific resources here. So the first one is this great book called The Ultimate Guide to Sex and Disability. It is like clear and practical. These authors discuss positions and assistive technology, communication tips. Like it really covers everything, and it's really, really like user-friendly and practical. So you can find used copies of this book online, but I'll let anyone take a screenshot here if that's or write the title down. That's a really, really wonderful resource. The second one is a website that I put up here called intimatewriter.com, and this is a resource for actually looking at assistive technology. So chairs and straps and things that can really help when there are pain conditions and disability. So some of those things are discussed in the book, and then that's a place where you can go and look for them. And lastly, this is a free manual you can find online. It is empirically sound, coming from a research background, just like the book. And it's a sexual device manual for individuals with disabilities. And again, there are so many different medical presentations and diagnoses. So some of it might be really relevant to someone and a lot of it not at all to someone else. But I encourage you to just poke around and see if any of these resources are helpful for you, because there's a lot more out there than we often realize. And now we'll talk about our specialty here in the pain psychology clinic, which is the interventions for the mind, or how psychology and mental health can play a huge role here. So the first one is if there's really depression or anxiety or trauma that is coming up with pain and sexual health, individual therapy to address these diagnoses can be incredibly helpful. Secondly, if you are really concerned specifically about sexual interactions and it's kind of separate from depression, anxiety, trauma that might be unrelated to sex, looking for someone who's a specialist in sex therapy to address difficult emotions, thoughts, and behaviors related to intimacy. So you might want to see someone who's an expert in depression if it just feels like the depression's getting in the way of sex, but there may be, if it's something really specific to engaging in sexual intimacy with your partner, a sex therapist might be really, really useful. Also pain psychology, to toot my own horn and my wonderful colleagues that are here tonight. So if you're maybe dealing just with self-manage, like having difficulty coping with your pain, just improving self-management of chronic pain is going to make more room for enjoyment of intimacy with your partner. So if you're having difficulty with just kind of the stress associated with back pain, that is something that you can work on with pain psychology, and we can address sexual health issues in pain psychology. And also mindfulness, meditation, and relaxation training can be really helpful, and those are great things to work on with your therapist. And if you already have a mindfulness or meditation practice, it can be really, really helpful. And we'll talk about some resources here as well, but I just want to kind of emphasize that because sexual health and chronic pain, it's just so tied to how we're feeling and what we're thinking. Getting professional help from a counselor, a psychologist can be really, really incredibly helpful. So I'm going to walk through these wonderful resources here, kind of give you time to write them down, take screenshots. The first one on the bottom left is just a brief, quick read article from Psychology Today. Not an empirical article, but written by two psychologists just to validate how there can be an enjoyable sex life even with chronic pain. So there's really brief tips on helping with communication and things to ask your providers about. It's not super comprehensive, but it's a nice first place to start to just kind of see, okay, other people have thought about this and are looking at it. Here's some things that I might initially bring up with my partner or with my provider. So that would be just a nice introduction to the topic. The second one is Dr. Lori Brado's book. It's fairly new, called Better Sex Through Mindfulness. And like it says on the title, this is really geared toward those who identify as women. But Dr. Brado is a psychologist in Canada, and her research has been on sexual health in women with cancer. There's often a lot of pain in that population. And so she developed a mindfulness protocol and runs a lot of wonderful groups to help with helping women with pain, with cancer, kind of re-engage with desire and improve their sex lives. So this book is so wonderful because it's incredibly empirically sound, but it's also like a workbook that just any person, you don't have to have a background in psychology or neuroscience. You can kind of read the book and use the exercises as your own manual to work through some of these challenges. And there's just wonderful mindfulness exercises and writing exercises. So I would definitely recommend that book. Next would be another really renowned researcher in the world of sexual health, Emily Nagoski. She has a lot of podcasts and is in a lot of TED Talks, so some of you may have heard of her. This is a wonderful book, not just geared toward women, but really open to diverse identifying individuals. And she has a background in neuroscience and She weaves in mindfulness and cognitive behavioral therapy and a lot of wisdom from couples therapy research. And just like Lori Prado's book, Emily Nagoski's book has a lot of exercises and like readings and activities that you do as you're reading it to help you learn about yourself and improve communication with your partner. And you don't have to be in a relationship to benefit from this book. A lot of it helps you deepen your understanding of your own sexual experience. And so she is wonderful. So I definitely recommend that book. Lastly is the Rosie app, which is a physician-founded app. This, again, is geared toward women, but it is an app all about sexual health in women, and it has a lot of different sections for different health conditions to kind of debunk things like we've talked about in this talk, but geared specifically toward different diagnoses. So you can see there's a section with a lot of great education about migraines and headaches. There's a lot of information about menopause. There's information about cancer and other pain. What's great about this app is you can kind of do a little bit or a lot. They have webinars and Q&As and one-on-one educational stuff and groups. There's just so much in this app, and it's developed by an OB-GYN and psychologist. So empirically sound and fun to use. And lastly, we'll talk about some important interventions for relationships. And so we've looked at the body, we've looked at the individual mind. We can't really talk about sexual functioning without talking about the couple, the relationship. The first difficult thing is how important it is to open the conversation with your partner. And so while I'm not going to spend the whole night giving direct advice because everyone's communication style in a relationship is different, but being able to just have a compassionate and calm conversation with your partner about what you're going through from a place of sharing your feelings is a place that I can say is really the best place to start. So if you can open the conversation with your partner, it's just, it's the best place to start. That's all I have to say. If that's difficult for you, which it is for a lot of people, couples therapy can really help improve communication between two people. And so regular, couples therapy just to work on communication, but also a focus on sex and intimacy. There's a wonderful sex and intimacy specific therapy called Sensate Focus. It came out of the Masters and Johnson work, and it's kind of like a desensitization type of therapy that really helps couples work on safe touch little by little to help someone get more comfortable and more calm with sexual intimacy, little by little, in a way that is really trauma informed, pain informed. So that's something that really can be led by a couples therapist. And I want to emphasize that when it comes to having a new condition or a chronic condition, intimacy might just look different than it did when you first met your partner. Or if you're single right now and thinking about dating or wanting to get back out there and have concerns, and the important thing is just having an open mind to how intimacy just might look different than you thought. And there might be different contexts that help you get there. And so it might mean that touch is different. It might mean that positions are different. It might mean that intercourse is off the table for a little bit or for a long time. But there are other things that you can work on, and also different contexts. So maybe at the beginning of your relationship, before an injury, it was super easy to go on a date night and get in the mood. Maybe now that there's pain or a traumatic injury, you need a lot more relaxation, a long bath, music, cuddling. So be open, and maybe instead of thinking of this as a new limitation on your sex life and your intimacy, it can actually be conceptualized better as a new way of experiencing closeness with your partner. So thinking of it as like a new frontier and a way to be close rather than a loss. So I'll walk through some of these resources here. The first one on the bottom left is another kind of introductory article just to sort of get your feet wet on this topic. So talking to your partner about sex when you suffer from chronic pain. I love this article. It's an easy read, but also really, really informative and validating. And I'll say that the Gottman Institute is a really wonderful resource for couples. John Gottman is like a renowned couples therapist, and people that are trained in the Gottman method are often very, very good couples therapists. They also do retreats and things. So I would definitely check out this website. Secondly, of course, promoting our own Stanford medicine. We have a couples and family therapy clinic. So if you're already seeing Stanford providers and are interested, this would be a great resource. And they have wonderful clinicians that can help with sex and intimacy issues. Next, again, the lovely Emily Nagoski. This is her latest book. So she has Come As You Are, geared more toward the individual. But Come Together is her new book that's really for couples about how to maintain lasting sexual connections. And there's so much about those sexual myths in this book, and also really wonderful like writing exercises to do with your partner. Great stuff for self-discovery. She's really inclusive about different kinds of relationships and different kinds of, open relationships and LGBTQ, and just, I think almost everyone could find some wisdom in this book. And then lastly, I mentioned Sensate Focus. So this is actually a manual that guides couples in sensate therapy. So these would be some evidence-based, wonderful resources just to check out and ask your providers about if you're interested in more. All right, so to summarize some key points. Cannot emphasize enough that if you are struggling with chronic pain and sexual concerns, you're not alone. It's happening with a lot of people. And I hope that this presentation at least brought some comfort and maybe some hope that there are things out there for you. Secondly, that getting help with these concerns really involves a biopsychosocial approach, and that there are evidence-based interventions out there. So just like getting help with the pain itself, the best approach is to be open to as many possible tools as you can arm yourself with in your toolkit. So that might mean looking at different things, physical therapy, couples therapy, mindfulness. There's just a lot of things. So the more tools that you try, the better off. And that the best place to start is to talk to your providers and your partners and go from there.